Syphilis cases in Kern County are 30 times higher than they were 20 years ago. That's according to the Kern County Public Health Department. Syphilis is a sexually transmitted infection. Division Director of Health Services Kim Hernandez says it can cause serious health problems if it's not treated.
Unfortunately, that bacteria is still in your body and it can cause damage to your heart, to your brain, to your nervous system, in 10 to 30 years after having infections.
And it can spread from a pregnant woman to her baby before it's born.
It's one of the most common causes of a late-term stillbirth. Genital syphilis, one can cause a fetal demise, but it can also cause a lot of long-term consequences.
Hernandez says Kern County began to see a promising drop in annual cases in 2018, but this year, cases are back up. According to the Associated Press, nationwide, cases hit 16 per 100,000 people last year, the highest in 3 decades. Hernandez says there are a number of reasons for this. With the pandemic, people stopped going to routine doctor's appointments. Social media and dating apps also made contact tracing harder. People go on and off the apps a lot, changing their locations and profiles frequently.
After identifying that case, identifying the people around them and trying to get them tested and treated became much more difficult.
Birth control became more accessible, so people started using other things besides condoms, which also led to the increase in STDs. But there is some good news.
The really good thing about syphilis, or what we have now, is that we have antibiotics that are very effective at treating syphilis, regardless of what stage you're in.
Hernandez says several Kern County emergency departments have begun testing patients for syphilis no matter what they go in for.
Our healthcare community has really rallied around us to say we're going to find all the people who have this because we can cure it.
She says if you're sexually active and haven't been tested, do so as soon as possible. The Public Health Department can connect you with low-cost or free health care.
We're hopeful. We're still building on that change. We're rebuilding it, getting our community re-engaged and really make sure we can see that trend go downward again.
Callan Hobman, 23BC, connecting you.